So the final part of Chapter 8, Blood and Immunity, is a re-review of the abbreviations. Most of them we've touched on throughout the first two parts of this live lecture. Remember, when you're completing your weekly quizzes, that pay specific attention to what needs to be abbreviated, what needs to be capitalized in the upper and lower case. And if you're asked to complete a sentence with the full word, if the word is in the middle of a sentence, it does not need to be capitalized, but if it is an abbreviation, you need to make sure that you're writing it exactly the way the abbreviation is. When you're writing in a medical record, it's very specific, and there are regulatory bodies that monitor the use of abbreviations and medical terminology, so there are legal ramifications associated with incorrectly writing abbreviations, because as you can see here on this page, AB and AG mean two totally different things, so accuracy is of the essence. So AB for antibody, AG for antigen, ANA for anti-nuclear antibody test, BMA for bone marrow aspiration, BMT for bone marrow transplant, BT for blood transfusion, CBC for complete blood count. We went into that in great detail. C and S for culture and sensitivity. And you can see, even though some of these abbreviations, the abbreviation is in uppercase, when you write it out, be sure to write it the way that it is designed in a lowercase. But with EBV, Epstein-Barr, because that is a disease, that is capitalized, but virus is not. EPO, erythropoietin, ESR, erythrocyte sedimentation rate, FE for iron, HCT in a couple different formats is hematocrit. So depending on where you're working, they usually have an approved abbreviation list, and you should be using the abbreviations on that approved abbreviation list only. HGB for hemoglobin, or HB or HGB, ITP for idiopathic thrombocytopenic purpura, PLT for platelet or platelet count, PT for prothrombin time, RA for rheumatoid arthritis, RBC for red blood cell or red blood cell count, SLE for systemic lupus erythematosus, VWD, von Willebrand disease, and WBC, white blood cell count, or white blood cell. And that's the end. Good luck studying.